Measles is so contagious that one infected person can spread the respiratory virus to 90% of people in the same room, and it can live in the air for 2 hours. Often, an infected person doesn't even know they have measles for several weeks. Early symptoms include a fever, cough, runny nose, and red eyes, all of which could be overlooked as part of a common cold. A skin rash doesn't typically appear until 3 to 5 days after the first symptoms appear. Someone with measles is contagious 4 days before the rash begins and 4 days after. There is no cure for measles, but if you receive the measles vaccine or are immune from a previous infection, consider yourself protected. And protection is a good thing, because measles is not a disease anyone, especially a child, wants to get. As many as 1 in 20 children who contract measles get pneumonia. That's a dangerous risk because pneumonia is the leading cause of measles-related deaths in children under age 5. Measles, from vaccine to elimination to outbreaks. Before the measles vaccine was introduced in 1963, the disease caused major epidemics every 2 to 3 years and 2.6 million deaths worldwide each year. But by 2000, measles was considered eliminated in the United States, thanks primarily to vaccination efforts. Eliminated is a term that means a disease was not continuously transmitted for more than a year in a specific geographic area. Another term, eradicated, means a disease has been eliminated worldwide. For example, polio was eliminated from the US in 1979, but still exists in other places around the world. Smallpox, however, was eradicated globally in 1980. But if measles was eliminated in 2000 in the US, why are there reports of new cases now? Basically, if a disease is eliminated, outbreaks, defined as 3 or more cases, can still happen if someone who is unvaccinated travels to a country where the disease is still common and becomes infected. Once back at home in the US, that traveler can transmit measles to anyone who is unvaccinated. In 2023, the World Health Organization reported a significant increase in measles cases around the world, including a 30-fold increase in Europe. Here in the US, as of March 7th, more than 222 cases have been reported this year, according to the Centers for Disease Control and Prevention. Most cases are linked to an outbreak in Texas. A total of 258 cases throughout the country were reported in all of 2024. Most of the reported cases have been in people who were unvaccinated or whose vaccination status was unknown. This is a serious, highly contagious viral disease, and the only strategy we have to fight it is vaccination. And that is a strategy that has worked very well for many, many years. If people are saying no to this vaccine, we need to consider what their reasons are and if they have the information they need. The power of herd immunity. Also known as community immunity. Herd immunity is achieved when a large majority of a population is immune to a specific disease. This indirectly protects people who are not immunized, and in some cases, those who cannot receive the measles, mumps, rubella, MMR vaccine, including children younger than 12 months of age and people who have weakened immune systems from a disease, cancer, or HIV/AIDS, or are receiving certain medical treatment such as radiation, chemotherapy, immunotherapy. If much of the population is immunized, it is difficult for a disease to spread. And as the number of people vaccinated increases, so does the protection of the herd. Depending on the disease, herd immunity may begin to show beneficial effects when just 40% of the population is vaccinated. But for particularly contagious diseases, that threshold is far higher, exceeding 80%. The vaccination rate should be about 96% to achieve herd immunity for measles. Meanwhile, vaccine coverage for kindergarten children fell from 95.2% in 2019 to 2020 to 92.7% in 2023 to 2024. And some states have coverage below 90%, according to the CDC. Young children are at highest risk for measles. Unvaccinated young children are at the highest risk for measles and its complications, which, in addition to pneumonia, can include swelling of the brain, severe diarrhea, and related dehydration, and blindness. Severe complications are most common in children who are malnourished or have immune systems weakened by HIV or other diseases. Children under age 5 are more susceptible to complications because they are more fragile in general and don't yet have fully mature immune systems. When you are smaller, your lung volume is not as large and your chest muscles are not as strong. So if you get pneumonia, that's a lot harder to fight. In some ways, the global measles immunization program has been a victim of its own success, particularly in the US and Europe. We've been so successful in decreasing the number of cases, and that allows people to say no to a vaccine because the disease is something they haven't seen before. Suddenly, people incorrectly believe the vaccine itself is the threat. It boils down to education. As medical providers, it is our duty to not just say, "Get vaccinated," but to explain in very clear terms why this vaccine matters. Parents' opinions on vaccination matter. While physicians are armed with the most up-to-date information about the harm a disease like measles can cause and the safety of the vaccine, it doesn't mean a parent's reservations don't matter. Talking to parents about any vaccination, whether it's for measles or the flu HPV human papillomavirus, is important, doctors say. Herd immunity protects vulnerable children. The CDC recommends all children get their first dose of the MMR vaccine between ages 12 and 15 months, and then a second dose between ages 4 and 6 years. Adults who were never vaccinated should receive at least one dose of the MMR vaccine. Those who were either born before 1957, because measles circulated widely before there was a vaccine, or immune, which can be determined through a laboratory blood test, don't need the vaccine. However, healthcare workers born before 1957 should consider getting a vaccine if they don't have proof of immunity, the CDC says. The MMR vaccine is 97% effective at preventing measles. No vaccine is 100% effective, according to the CDC. In the unlikely case of a vaccinated patient developing measles, the disease tends to be weakened. The fact that measles is occurring in communities should not cause panic. It should lead to all of us ensuring we have done everything we can to be protected. The vaccine is live, which means it contains a weakened version of the virus. Therefore, children with an immunodeficiency from receiving chemotherapy for cancer, for example, are unable to receive the vaccine while their immune system is compromised. This is one of the most important reasons to vaccinate the rest of the population, to protect our most vulnerable children who cannot receive the vaccine due to these illnesses. They benefit from the herd immunity provided by the rest of their community being immune to diseases like measles and are at most risk during these outbreaks. If you are feeling under the weather, American Family Care Joplin is open 7 days a week from 8 to 8 on weekdays and 8 to 5 on weekends. AFC Urgent Care Joplin is located just off 3rd and Rangeline behind the Starbucks. American Family Care, the right care, right now.